I'm Dr. Manoj from Chennai, Avadi. So today I had a point like healthy mind and body with alternative therapists. So I like to know how many of them know about alternative therapy and what is your view? Because until unless you doesn't know about alternative therapy, I can't explain little briefly. So if you have an idea, you can express it out here so that I can say something about alternative therapies, because alternative therapies in today's day, everyone have a different uh, thoughts and their views and all. So I like to clear everyone's mind about alternative therapy today. So can you share something which you know about alternative therapies and what and all it comes under alternative therapies? Is there anyone? Okay, well, uh, I think people doesn't know about the alternative therapies. So I myself tell about alternative therapy. Of course, alternative therapy is not basically an alternative therapy because it is a initial therapy which was found along with a human when the human life started from the beginning of the world. The alternative therapies which is said to be like acupuncture, acupressure, those kind of things like Ayurveda, Siddhas, those things are not alternative therapies at all. These are the basic therapies, these are the basic medications which started from the initial stage of human being. And acupuncture, what we say today as acupuncture, it is derived from uh, Kalaripite, which I don't know many people knows about Kalaripite. Kalaripite is a ancient martial arts which have uh, Varma marmams, marma pulligal we say, marma points, and many massage kind of things, even Ayurvedic oil, Ayurvedic treatments, Ayurvedic herbal medicines, those kind of things, everything was there in Kalaripite. So from Kalaripite only, these acupuncture, acupressure, Bharatanatyam, karate, kung fu, whatever is streaming now in the world, in conscious world, these things, everything extracted from Kalaripite only. Now, what happened to Kalaripite? Kalaripite is taught only few places in Kerala and a few places in South Tamil Nadu. So, Kalaripite is a uh, main track where these kind of alternative therapies came into the field, and now alternative therapies is said to be a secondary method of treatment, and allopathy became the first method of treatment because Western medicine have scientific proof, and whereas alternative therapies cannot give some scientific proofs, which is actually inbuilt, which is already inbuilt in our body, and those things only we are trying to uh, stimulate and bring it. Like what I say is a healthy mind and body. What we require in healthy mind and body is first thing. A lot of people will be having the physical problems by birth, like they'll be having some legs or hand involuntary movements, traumas, injuries. If those kind of problems uh, will automatically be a big stressful life in for a normal healthy person, isn't it? So what we say here is to make a healthy mind and body, we should have some positive attitudes, positive thoughts, positive visions of life, positive habits, positive talks, and so on, we can say. these positive things itself will make the body and mind polished. So in my treatment here and in my clinic, I just don't straight away enter into a human body for alternative therapies or medications or massage, whichever be. But basically, I like to change their lifestyles. First, basically, I will try to change their lifestyles, like their food habits, their bathing habits, their routine things, those kind of things, and all I'll try to change. Even the things which they do in the outside world, like drinking chilled water, having lots of non-veggies, so those kind of things also I used to try to make them shift little by little to a natural way of living. So, so that I used to stimulate some positive thoughts, because the person who comes here for treatment, they already go to every hospital, big hospitals. They have lots of scan reports, everything they bring. At last, the thing is, basic thing is, they doesn't have the um, energy to think that I am good, I am fine. They think that I am already gone. Uh, in few days, I'll be going out. So those kind of thoughts will be there already in their mind. So slowly, I used to change their uh, life, change their habit, then change their thoughts by stimulating some positive thoughts. So basically, I used to create. I used to tell that create by telling yourself in an inner voice. Always say that I am good. I am doing this. I am succeeding. I am healthy. I am painless. So these kind of words, like we saw a film of Vijay. Uh, I am well, something like that. Word was that. So that picture was actually, it is exactly a good film for a psychological problem, because psychologically many power to come out from the
Dr. Manoj, it is all is well, all is well.
yeah, exactly, all is well, all is well. So that is a mantra, actually that is a mantra. So those kind of mantra, so if I say that is all is well to a patient, suddenly they'll think about Vijay and they'll be saying pictures like that. So I don't used to say the same words, but natural things like I am good, I'm doing this, I'm succeeding, I'm healthy, I am painless. So these kind of words which we can stimulate into their mind, pierce into the mind and heart, by saying that tomorrow morning, early morning, while waking up, you go to the mirror, front of the mirror, you see yourself. You what to say? You think, you see your beauty, your handsome, your beautiness in front of your mirror itself, and say these kind of words daily, at least 108 times. This 108 time is not a mantra, actually. This 108 time is a thing which, when we say a positive words continuously without stop, that will automatically enter into our body, mind, and the negative things whichever he had earlier will be decreasing slowly. So this is a basic thing what I do in my clinic, because until unless a patient have a positive mind, I can't ever change their problem at all. So this thing is a basic thing which I do here. So this is the thing which I want to say to the student also. If a student, when they study, they'll be having lot of problem with teachers or lecturers, whatever the students, some gunda students. So so many problems will be creating in their college life and even outside. So until unless he is until unless he or she have a confident with him or with her, she can uh, move ahead without any distraction. So I say to the student that basically when you wake up, you think that I am good, I don't have any problem, I am good, I'm succeeding in life. So these kind of words will automatically strengthen our body, strengthen our hormones. The good hormones will be extracting, and these good hormones automatically will decrease the depression level. So this depression itself will carry many kind of diseases, like they have stress in job, stress in home, stress from children. Even some married peoples will be having stress from children, husband, wife, so etc etc. Stresses from society and climatic change also. I have seen many patients coming here that due to climate change itself they have a lot of problem. Why this autumn season is coming, why this spring season, why this rainy season is coming. So because they will be having some bad effect the earlier stage of life. So that will create a panic in this situation when a rainy season. So those time I have to actually change their mind. Instead of giving a medicine, there is no use of giving medicine, because medicine doesn't change anything, because medicine, it just suppress everything. So I advise, and I used to counsel them and uh, change their habits, change their attitude about life. Those things I used to first introduce themselves. And the second level of treatment is actually, if a stress is increased in our body, you'll be knowing what and all disorders will be coming. Like now in Western medicine they say so diabetes as a disease, but basically, is diabetes a disease? Can you say? Diabetes is not a disease at all. Diabetes is a condition where the body change due to our lifestyle. So whether it is reversible, reversible. Normally, when Western medicines people say that diabetes is not reversible, few Western that diabetes is reversible. But in alternative therapies like acupuncture, like homeo, Ayurvedas, uh, we clearly say that diabetes is a reversible. But diabetic 1 cannot be reversed as easily until unless the beta cells or pancreatic that insulins, everything is secreted in a normal way. We can't immediately change to the diabetic to normal person. But diabetic 2 is 100% reversible, and I had many patients who have cleared diabetes 2 and they are well now. So even now even they test their medical reports. They used to say that, sir, till now I have no problem with the diabetes. So this diabetes, it is not completely for 100 people. Out of 100 people, I can at least change 80 people's. 20 people's I can't change, because their method of their thoughts, everything is different. So this 80 people's, if I have to change, I have to change the lifestyle. I have to make them to bring out of the stress levels, various problems in their lifestyle. Even I have to interfere into their life matters, where an husband and wife will be having problems. Even the children's will along with them will be having some problems. So those things will increase the stress level, where dopamine, one hormone, will be uh, decreased, will be in low hormone production will be happening. So that what happens, the stress levels will be increasing day by day. When the stress is increased, the diabetic disorders also increases. Not only diabetic disorders, thyroid disorders, various pain related problems like joint pains, cervical pains, fingers joint pains, and even disorders like anger. Many people say anger is a disease. Anger is not as a disease. Anger is a disorder. Like anger, anxiety, some phobias, even infertility, inferiority complex, and like menstruation disorders, pregnancy. This everything will be affected due to this stress. So moreover, we can see that if a person having a girl having a menstrual disorders, immediately they go for some treatment, Western treatment. They give hormone tablets and they will try to produce the menstruation. When they take the medicine, the menstruation level will be correct. When they stop the medicine, immediately the menstruation level will be as earlier it stops completely. And again, the thing is their depression level will be increasing, so that tomorrow later on fibroids, cysts, these kind of problems will be evaluated in this uh, uterus. So basically, I say to our patients that if you're coming to my treatment, it should be we have to drop every hormonal medicines. Basically, I don't keep hands on vitamin tablets or calcium tablets. Those things I don't keep hands, because that is okay. It's a natural way of taking, because we don't take calcium's rich food. So I used to say, okay, it is all right, you can take. But hormone tablets, those things and all, I used to stop, because hormones should be produced naturally. Indeed, it should not be produced with medicine. So because medicine doesn't cure any problem. So I used to decrease the stress level, change their lifestyles, and automatically when their stress levels are decreased, the menstruation periods also increase. Mm, Along with that, there are some points in acupuncture, like I will tell the points, but you won't be having that realization, because uh, after studying acupuncture only we realize what is the point. Like P6, P6 is here in this part of place. This and H7 is here. So these points, when we insert needle or give an acupressure points, automatically the hormone levels are balanced. So when the hormone level is balanced, their stress level also reduces. So when the stress levels are reduced, people start to speak to people, their parents, or they speak to other friends normally. When they start to speak normally, the society also mingle with them. When the society mingle with them, their stress level decreases and they find to be happy in the society. So naturally, what happens when they are happy with the society, the menstruation level will decrease, headaches are gone, cervical pains are gone. Even though cervical disorders might be there, like a disc bulge or disc prolapse will be happening in their body, but even though that pain will be completely erased. So pain can be decreased by a lot of lifestyle change. So I say, student, that try to be happy always, never get stressed. And whenever you get up in the morning, try to see your face straight. Many people doesn't see your face at all. First go for there were a habit when the people when get up, they immediately see their hands, rub their hands, and massage their face. This should happen daily. Whenever you get up in the morning, in the olden days, they used to say that when you open the hand, you have to see God in your hand, those things. But that is something different. We no need to see that. But instead, scientifically, what we say, when we open, we rub your hand very nicely till the hand gets warmed up, and just massage your face first, so that there are many acupressure points over our like I'll say in our eyebrows, faces, nose, even mouth, tongue, everywhere there we have acupressure points. Those acupressure points, along with your hands, in our hands also we have acupressure. When we rub nicely, these acupressure points will stimulate, and when we rub over the face, the friction between our hand and face will increase, so that blood circulation will increase. When the blood circulation increases in our body, in our face, automatically the whole day will be very good for you. So to reduce the stress level, I think first level of your treatment will be this. Whenever you get up in the morning, there is a background sound. Okay, whenever you get up in the morning, try to rub your hand nicely, rub over the face so that your blood circulation increases, and simultaneously see your hand or see the mirror, the front of the mirror itself. You can go and stand. You see your beauty of your face first, how beauty you are. You think yourself as a beautiful person. Don't think that I am ugly, I am black, I have bald heads. I am also bald heads and white hairs. These are dyes. So these things, everything, just erase from your mind and think that I am happy. I don't have any problem. So those things, what I said earlier, those things, if you say regularly in the morning and evening before bed, that will be that will increase your hormone level. It will balance complete hormone levels. And in the morning when you get up, you'll feel very fresh. And open up all your windows, inhale the uh, inhale the what you say, prana energy, which is spread all over the area. Try to inhale. But the thing what I want to point out is, never wake up after 6 o'clock. After 6 o'clock, if you wake up, the complete organ clock which we have in our body, there is a organ clock theory, because each and every organ have its own time, specific time to activate and reduce its level. So those things will be imbalanced. So when it get imbalanced, like for an example, I'll say, there is a saying that get up early morning, like Jnanis, yoga peoples, they wake up at 3:30 a.m. itself. Why? Because from 3:30 to 5:30 is the time, sorry, 3 to 5, sorry, 3 to 5 is the time for our lungs. So the good energy which is spread all over our universe, when the oxygen level increases uh, in the universe, because 3 o'clock the plants get wake up and it start to produce oxygen, and it relieves oxygen instead of carbon dioxide. So fresh oxygen will be relieved to our universe. So when there is no vehicle pollution or anything, smoke pollution, those areas will be the best place for our home also. So open our windows, try to take the prana energy within the time specification 3 to 6. This will be the ideal time. After 6, automatically you know that our air is getting polluted. uh, Even noise pollution, water pollution, air pollution, everything will be starting from 6 a.m. because a lot of vehicle will be traveling. So 6, after 6, even our body organ, like lungs time is 3 to 5. Okay. And 5 to 7 is our large intestine time, because large intestine, we have to relieve our stool in the time between 5 to 7. This is the ideal time to relieve our stool. If we don't relieve the stool within the specific time, after 7 a.m., if we trying to relieve, that will constipate automatically. This constipation will indeed it turns as a piles in the future. But starting in this time, when our bodies form, like young people, they won't understand these timings, because they are not there. They doesn't uh, yeah, I mean, they doesn't know about what is going to happen in the future. So as a doctor, as a therapist, I see many people. When I take the history, the life histories of what he was, and in the young time, what he did. So these histories uh, reflects these things. Like they used to wake up at 7 o'clock. They used to wake up 7:30. Then thereafter, after 3 years or 5 years of time, we find that they have piles. So see, this is the lifestyle. And the earlier time, when our ancestors were, they used to get up at 3 o'clock, 4 o'clock, and all. They go for a walk. They drink a lot of water, and they go for sunlight. See, nowadays people doesn't enter into sun because they say when I enter into the sun, my skin gets tan. But the ultimate thing is until unless a vitamin D, which is produced from sunlight, which enters in our body, is very much essential for calcium, for production of calcium. So if when the calcium is reduced, vitamin D is reduced, calcium also is getting reduced in body. For an example, I used to say, for a lady, a normal lady, around 1200 mg calcium is required per day for a normal body metabolism. Whereas when you take some green leaf vegetable or some vegetables, per day, we can say around 600 mg or much lesser than that we consume. Balance the rest 1000 mg or 800 mg where it goes. So body, what it does, it takes from the bone. Bone have lots of calcium, phosphorus, magnesium. So it tries to take from the bone. What happens in the future? The bone density gets reduced. The bone gets to osteoporosis condition. So osteophyte, osteoporosis condition. So what happens in the future? Around 30 years of age itself, many people come in the problem like, say, they have osteoporosis. So basically, at the time of osteoporosis, what Western medicine say that it take a lot of calcium, and they give artificial vitamin D. Vitamin D artificially we can't create in tablet. It is in some fish, which like matti and all would say. So those fish have some vitamin D, whereas larger quantity of vitamin D is in sunlight only. So sunlight is very much essential. So this is the thing what I say to our my patient, to wake up before 6 o'clock, take a span of time of 6 to 6:30, go for a walk, get an early sunlight, sun rays to your body. Our skin doesn't get tan in those time of period. That tan condition will be the time of 9 to 12 or 11 to 12. Those in this condition only our skin get tans. So around 6 to 7 is the ideal time to get vitamin D. So half an hour is enough for our body. Even foreigners, you can see that they sit around the ocean in beaches to get sunlight. So we have sunlight naturally. God has given us sunlight. Even Surya Namaskara is done in the time 5 to 6 or 7. This is a time when we have to stand in front of the Surya sun and do Surya Namaskara. So the Surya Namaskaram itself is to get energy from sun. So this thing, everything has they nowadays our students, even many youngsters say that this doesn't have, I don't have any problem. So now I don't want earlier at the age when some problem create to me, that time I will see this. So at that period of time, around 40 years of age, when you come as an osteoporosis condition, no medicines will uh, get a good things to our bone, because bone is already gone. So when an osteoporosis condition, we can only manage his bone density, like more, it doesn't decreases the level of what now it is. So this is the thing doctors can do. So it's my request that students kindly wake up around 4 o'clock or 5 o'clock, take plenty of water. What I said, go to the mirror, stand in the front of the mirror, think you as positive, lot of positive things you take in your body by thinking that I am good, I am fine today, I don't have any problems. So those kind of mantras which you can write and keep, those mantras, that and all you can say in front of the mirror, and take plenty of water, do your routine. 6 to 6:30, try to go for a walk, stand up below the sun, and get good energy, prana energy. So this around 5 to 6:30 or 7. This is a good period for the whole lifespan of a human being. So never miss this period. After this, you can do anything. Whatever you do, that and all is okay. You can even go for You can sit under air condition for many hours. There won't be any problem. But basic things at the time of the beginning itself, you. So the day should start from your lifestyle. Okay. So because nowadays we are in a modern world, so we can't say that you have to wake up, you have to go for a walk, you have to run, you have to do this, that, this and all. It doesn't happen. Which world has changed. So this period 5:30, around 6:30, 5:30 to 6 or 6:30 is, it is idle. You can do. Anyone can do. Time is there.
That's really very great, Dr. Manoj. And Dr. Manoj, Dr. Manoj பத்தி நான் சொல்லணும்னா ஸ்டூடெண்ட்ஸ் எல்லாருக்கும் கமிட்மெண்ட் அப்படிங்கிற ஒரு வார்த்தை பத்தி நான் சொல்லணும். அதாவது ஆக்சுவலி his father-in-law passed away very recently, and just a couple of days before, but still he is committed to this particular session that he would be delivering the lecture, and he is on time here. Kerala இருந்து வந்து அந்த கமிட்மெண்ட் கீப் அப் பண்ற. இப்போ அவர் பேசினது எல்லாமே கேட்டிருப்பீங்க. அந்த கமிட்மெண்ட் அப்படிங்கிற ஒரு வார்த்தையை எப்படி சாதிக்க முடியும்னா அதுக்கு நிறைய எனர்ஜி தேவை. அந்த எனர்ஜி எப்படி கிடைக்கும் அப்படின்னா அவர் ரொம்ப அழகா உங்களுக்கு மாற்று சிகிச்சையை பத்தி உங்களுக்கு ஒரு தெளிவான விளக்கமும் கொடுத்திருக்காரு. அட் த சேம் டைம் என்னெல்லாம் செய்யணும், சிம்பிள் திங்ஸ், ரொம்ப பிரமாதமா பெரிய பெரிய விஷயங்கள் எல்லாம் செய்ய வேண்டிய அவசியமே இல்லை. காலையில நேரத்துல எழுந்திருச்சுக்கணும். அதுக்கப்புறமா வந்துட்டு அந்த மிரர் மெடிடேஷன், மிரர் முன்னாடி அஃபர்மேஷன்ஸ் எல்லாம் சொல்லியிருக்காரு. தண்ணி நிறைய குடிக்க சொல்லியிருக்காரு. ஒரு ஹியூமன் பாடி, ஒரு ஹியூமனுக்கு வந்துட்டு எந்த அளவுக்கு ஒரு டேஞ்சர்ஸ் வரும் அப்படின்றது, அந்த எலும்பு தேய்மானம் எல்லாம் வந்ததுன்னா அதுக்கெல்லாம் வந்துட்டு ஒரு தீர்வே கிடையாது. ரொம்ப கஷ்டப்படணும் அப்படிங்கிறது தெள்ள தெளிவா அந்த உடலை எப்படி பாதுகாத்துக்கணும், மனசை எப்படி வச்சுக்கணும், அண்ட் உணர்வுகளோட வந்துட்டு நம்ம எப்படி பேலன்ஸ்டா இருக்கணும் அப்படிங்கிறத அந்த மாற்று சிகிச்சை மூலம் எந்த அளவுக்கு இது எல்லாத்தையும் ஒரு ஹியூமன் லைஃப்ல அப்ளை பண்ணலாம் அப்படிங்கறது ரொம்ப அழகா சொல்லியிருக்காரு. அண்ட் ரியலி தேங்க்யூ சோ மச் டாக்டர் மனோஜ். despite of your challenge, despite of your loss, keeping up your commitment and coming and delivering this session is really that amazing quality one possesses. And I would also like to share here, he had won the award heart winning doctor அப்படிங்கிற மாதிரி ஒரு அவார்டு வந்துட்டு he has been given. That is how he is what to say, come from அந்த ஒரு ஏர்ஃபோர்ஸ்ல இருந்து ஒரு நல்ல பொசிஷன்ல இருக்கிற ஒரு ஜாபை விட்டுட்டு சர்வீஸ் பண்ணணும் எல்லாருக்காகவுமே அப்படிங்கிற ஒரு முடிவு எடுத்துட்டு இன்ன வரைக்கும் அவரோட பாதையை நோக்கி அவர் போய்கிட்டு இருக்கார். அவரோட கிளினிக்ல பாத்தீங்கன்னா காலையில இருந்து நைட் 10 o'clock மேலயும் பேஷண்ட்ஸ் அப்படியே ஃபுல்லா தான் இருப்பாங்க. That is the level of dedication and commitment to this field he is rendering. Thank you so much, Dr. Manoj. We are very privileged and honored to have you in this ACHARYA 2022. I just pass it over to Vaidik.
Thank you.
Dr. Manoj, I think that was an excellent session. What really, one thing that really took me was the simplicity of very basic things that we can do to really transform the way in which we work and the way in which we can live our lives more efficiently. I can actually connect to one of the things you said about rising early, because even when I am working late nights or even when I'm under pressure or something, I make sure that I wake up every day at 4:30 in the morning. Come what may, I'll wake up at 4:30, spend about 1 hour, just 1 hour of me time, and only then start my day. And I can say for sure that it has a very, very positive impact on the quality of work that I do and the quality of life. So I think you had a lot of takeaway for the students who have joined us both over here on YouTube. So, sir, Dr. Manoj, thanks a lot for spending your valuable time with us and enlightening us with such wonderful tips. Thank you, doctor.
Thank you, doctor. Thank you.
Thank you. Thank you.